So in this patient, based on the pathology features that we're seeing, we're thinking that this could be multicentric Castleman disease. So the first thing that we need to do is to do LANA1 staining. LANA1 will tell us if this patient is HHV8 positive. HHV8 or KSHV is a virus that lytically replicates and can cause a systemic inflammatory syndrome, which results in multicentric Castleman disease. We know that this typically occurs in patients who are immunocompromised, whether it's due to the HIV virus or for some other reason. So the first step is to figure out, is this patient HHV8 positive or negative? In HHV8 positive MCD, we know that the HHV8 virus lytically replicates in B cells and then secretes cytokines that cause a cytokine storm and lymphoproliferation. That is Castleman disease. It's the viral replication in the virus that's driving the disease. Now in HHV8 negative multicentric Castleman disease, there's a very similar cytokine storm and also lymphoproliferation, but we're not sure what's causing the cytokine storm. So that's why we call it HHV8 negative or idiopathic multicentric Castleman disease. So it's really important to do that LANA1 stain, and then if it's LANA1 negative, you're leaning towards idiopathic multicentric Castleman disease, but it's really important to still consider some additional diseases that can overlap or mimic multicentric Castleman disease, and that's Hodgkin's lymphoma, non-Hodgkin's lymphoma. You want to perform a bone marrow biopsy to make sure that there's no clonality within the bone marrow. But at this stage, we're really thinking, based on the previous labs and the lymph node pathology, that this is idiopathic multicentric Castleman disease of what's called the plasmacytic subtype.